Protect healthcare whistleblowers. That's the call from the Progressive Health Forum. It says Gauteng Health is forging ahead with a disciplinary action against Dr Tim de Maayer. You'll remember he was suspended and later reinstated for calling out poor conditions at Rahima Musa Hospital. Let's speak to Caroline Corbett. She's the president of the SA Society of Anaesthesiologists now about this particular matter. Dr. Caroline, good morning and thank you very much for your time. You maintain, or at least we understand, that doctors continue to be victimized for speaking out, but particular Dr. Tim de Maayer. Is this in fact the truth?
Yes, unfortunately, the patient does not come before the politics at the moment, and this is what we are trying to take a stand against, and this is where the I Am movement came from. We cannot have healthcare workers who are doing what they are trained to do, as is the instance with Dr. Tim de Maayer. His training was to put basic human safety, healthcare, access to quality care as a paramount in the forefront of what he was trying to deliver. And we are trained to call out and shout out if this isn't the case. He did what he was trained to do, and he escalated this appropriately and has been penalized, and there's been punitive action taken against him. Still, despite our call for all of this to cease and desist.
So what exactly is the latest? His suspension was lifted. They opted to forge ahead with a disciplinary inquiry. What is he being charged with now? Is it perhaps speaking outside, perhaps the confines of the institution, the health sector? He was supposed to keep it a secret and use those channels as opposed to an open letter. What is he charged for exactly?
So channels were followed, but as we're all aware, when it comes to an employer-employee relationship, you're mandated to escalate any complaint within the confines of that society or of that institution. This is exactly what he and his colleagues did. This is what many of us have done previously, and you're not supposed to speak outside of that organization in the public space. What happened here is that Dr. de Maayer repeatedly escalated concerns and escalated them appropriately, and no action was taken. So he did what one would expect to do in a corporate space. You would escalate it to what you would see as your shareholders, people with the greatest vested interest in that. And that is our patients and the public. So he was called out and actions continued on because he spoke outside of that realm. So what we're seeing is intimidation. And the second letter by the Progressive Health Forum spoke to this constant intimidation of Tim Demayer and his colleagues, and still no action taken with investigation of the CEO and a significant inquiry and audit in what's happening in Gauteng Department of Health specifically. This is not unique to Rahima Musa. This is a symptom of a much greater problem outside of the confines of just that hospital and one doctor and his group's stance against this issue. We need to not see this as an isolated incident, and that's what's really, really critical for us to understand. Our health sector needs resuscitation urgently, and urgent attention and prioritization outside of just this one incident that people are focused on.
Do you have the ear of the MEC, though, in this instance?
There have been meetings with the MEC. There has definitely been communication. There have been letters sent, and there were solutions posed by groups that met. A 6-month plan was proposed, and there really have been discussions around this, because there's no point in just throwing stones and not actually bringing solutions. That's not what we're about. What we're trying to say, though, is that without collaboration from the MEC, from the Department of Health, we're absolutely impotent in this situation. And that's why I say this is not a state sector Rahima Musa problem. This is a South African problem. And we really, really cannot stress it enough, need to put patients before the politics and need to call for urgent accountability and actionability. There needs to be less talking now and actual intervention, critical intervention into what's happening.
You know, it's honestly very unfortunate that a disciplinary inquiry would continue, because when there was outcry, it was not just for the suspension to be lifted, but any form of victimization beyond that open letter. So this still falls within those confines, within those parameters, that this might very well still be a process that's unfolding, but he's now physically at work. So what honestly is the MEC saying about this? What is the sentiment of her office about this?
There is currently much denial that there is any further intimidation happening. And I don't want to comment on the hearsay as to who said what where, but I can tell you we have yet to see any actionable outcome. And we've yet to see any evidence that there's been a formal investigation into the CEO, into the conditions that exist there. The infrastructure, the human resource concerns, all of the things that were raised that were putting patients critically at risk and significant obstacles in place that resulted in doctors and healthcare workers being unable to deliver care. These things are not being addressed, and there is a significantly antagonistic environment. We see this outside of the healthcare sector in South Africa, where whistleblowers often come to fatal outcomes.
But can Dr. Apologies for interjecting. Apologies for interjecting,
yes, no,
but has Dr. de Maayer confirmed to you that indeed there is a disciplinary process that's continuing? And has he told you the exact charges? Because one would assume, like I said, that he would be celebrated for having brought this to the public's attention, and now they must investigate the issues that he outlined in the letter. So can you indeed confirm that he's being put through a disciplinary process? And please, can you just state the charge? Is it for speaking out publicly?
The charge is to do with speaking out. And we're not supposed to speak outside. As I mentioned, we're mandated to escalate only within our institution. It was the same when I was training within the state sector. You were not allowed to speak to the press. You were not allowed to take institutional issues outside and effectively speak poorly about your organization. These had to be addressed within the facility. And this is the concern. These are not being addressed within the facility. Dr. de Maayer's charges currently, as they sit, his suspension was removed. He was allowed to return to work, but they are still looking at disciplinary action. And there is still intimidation of the groups that speak out, and there is still no concrete evidence that they are taking action and actually changing the circumstances or investigating why. Why would somebody put their career on the line and risk disciplinary action as a good standing citizen and an outstanding clinician? Why would he do that?
Because we understand organizational culture. We all understand there is organizational culture and there are rules, but I'm sure if he can prove that he attempted to escalate this matter to a certain level and nobody listened, then perhaps it would be something that should be overlooked in this respect, that you in fact failed him. Here is the communication to various heads about the problem. It's honestly very disturbing. But Dr. Caroline, thank you very much for your time. We'll most certainly look into the story and perhaps try to get the health department to get the latest, at least from their side, what exactly is happening with Dr. Tim de Maayer.